Welcome to our series on being pregnant in a pandemic, a guide to prenatal care for low-risk pregnancies. My name is Lara Rosenberg, and I'm a family doctor who practices low-risk obstetrics. This series consists of 7 videos covering important aspects of what you need to know about your care during your pregnancy. Feel free to pause here and read more about it. Take a minute to pause here and fill out our pre-survey, which will help with understanding the impact of our educational videos on you. This presentation will focus on the part of your pregnancy after your due date or after 40 weeks gestation, and will include induction of labor, planning for your delivery, the need for ultrasound, and postpartum care. So, you have reached full term and it's past your due date, but the baby just won't come. Now is the time where we will discuss induction of labor. There are many different ways to induce labor, and it will be important to speak with your healthcare provider which method is best for you. I'm going to discuss the methods we use at our hospital. For induction, we must first examine the cervix to see if it's ready for labor. The cervix starts out as a muscle that is hard and closed, and starting contractions on a muscle that is hard and closed is very ineffective. We want the cervix to be softer, thinner, and more open. So if the cervix is not ready, then you will be offered something called cervical ripening first, or getting your cervix ready for labor. There are 2 methods of cervical ripening. The first is mechanical ripening, where a Foley catheter is inserted through the cervix and into the opening of the uterus. The catheter has a balloon at the end of it, and it's filled with water, which puts pressure on the cervix to open it with mechanical force. So there's no medication involved in this method, and the Foley catheter usually remains inside for around 12 hours or until it falls out. Second method of getting your cervix ready for labor is with a medication called prostaglandins. So this medication is inserted vaginally and placed under the cervix like a small flat tampon. This medication requires monitoring of your baby every 12 hours or more frequently and remains in the vagina for up to 24 hours or until labor starts. The medication may need to be removed sooner if it affects your baby's heart rate or if your water breaks. So you will have detailed instructions when you leave the hospital on when to return or when to pull out the medication. So once your cervix is ready for labor, there are a couple of options to get you into labor or to start labor. One method is by artificial rupture of membranes. For this, your doctor or midwife will insert a small hook through the vagina to break your baby's water. This allows your baby to move down and put pressure on your cervix, and also release your body's natural hormones to help start labor. You may also require a medication called oxytocin, which is given to you via intravenous to start your contractions. The amount of oxytocin is adjusted until you have regular contractions. Once on this medication, your baby will require continuous monitoring of its fetal heart rate. A biophysical profile, or BPP, is an ultrasound to make sure your baby is healthy to remain inside past your due date. It looks at your baby's breathing, tone, heart rate, and fluid around the baby. It's important to have this ultrasound when you are past your due date. Preparing for postpartum. So this is a pretty busy slide, so you can pause here to read specific details. So I'm going to go over a few things from the slide in more detail. So after you deliver your baby, you will have bleeding. And the bleeding will usually be heavy like a period that tapers off over time, and the bleeding can last up to 6 weeks. You may also experience a gush of blood while you're breastfeeding, or if you're lying down for a while and then get up suddenly, and this is okay. You are to seek medical attention if you're soaking through a pad every 1 to 2 hours. So your period may take a few months to get back to normal. And depending on whether or not you're breastfeeding, it may take up to a year for your period to return. It is normal for your hands and legs to swell, and this usually goes back to normal around a week after you deliver your baby. However, it's important to note that it's not normal if one leg is more swollen than the other, or if you have pain or redness in one leg. This could be a sign of a blood clot and requires you to go to the hospital immediately. So there needs to be follow-up for both you and your baby. Your baby needs to see the doctor, so either your family doctor, midwife, or pediatrician, within 2 to 3 days of being discharged from the hospital. For you, you should call your healthcare provider for a checkup 6 weeks after the birth. You may need to call your doctor sooner if you're having concerns of bleeding, pain, infection, concerns with breastfeeding, or concerns with your mood. It's really important to accept help from others. Let people help you with meals and chores and childcare. Remember, you don't always have to entertain your visitors. Set boundaries if you don't want too many visitors coming. You have to do what's best for you and your family. Postpartum pain. So pain is common after delivery and can last up to 5 to 6 weeks. Tylenol and Advil are safe to take with breastfeeding, and in the first few days, you may need to take this medicine regularly. For a vaginal delivery, on the postpartum floor, they will probably give you a squirt bottle. So take that home with you and fill it with lukewarm water and spray it while you're urinating, just to prevent any irritation to the area. Again, make sure to keep your stool soft and regular and avoid straining. Sitz baths with plain water or soaking in a bath can be very helpful for dissolving your stitches. For a C-section, it's important to keep the incision clean and dry. Avoid straining or lifting things heavier than your baby, and you should avoid heavy housework if possible for the first 6 weeks. Postpartum depression. Postpartum depression is different from baby blues and is a more significant depression that lasts much longer. It usually starts within the first month after childbirth, but can begin at any time within the first year postpartum. 23% of women report feelings consistent with either postpartum depression or an anxiety disorder. We'll go over some of the symptoms now. You may feel sad, tearful, and not yourself. Some new mothers may feel anxious or irritable. You may have decreased interest in doing things that you previously enjoyed and may experience changes in sleep or your eating patterns. Some women feel guilty or ashamed. And some new mothers have thoughts of harming themselves or their baby. If you are experiencing any of these symptoms, it's extremely important to contact your obstetrical provider or your family physician. There are many options available to you, including therapy, support groups, and medication if needed. It is also important to ask for help from your partner, friends, or family during this time. Exercise is also important to help with your mood, and really try to sleep when your baby sleeps. I know everyone will say that to you, but please take that advice. This can be a very overwhelming period in your life, and know that you are not alone, and people are there to help you, including your healthcare provider. Contraception. Sex after birth can be uncomfortable, very uncomfortable in the beginning, so it's really important to go slow and do what is comfortable when you are ready. Lubrication may also be very helpful. So even if you're breastfeeding, you may still get pregnant, so it's important to use contraception. There are many different types of contraception. You can pause here and take a look at the screen. We're going to go over some of the methods, but it's very important to speak with your own doctor on which method is best for you. So condoms are one type of contraception. The second type is the combined estrogen and progesterone option, which comes as a pill, a ring, or a patch. This medication is safe once breastfeeding is well established. Some common side effects are spotting, which can last up to 3 to 6 months, breast tenderness, nausea, headache, weight changes, and mood changes. Please speak with your doctor to ensure this medication is safe for you to take. The other option is the progesterone-only pill. You must take this pill at the same time every day for it to be effective, and it has no effect on breast milk supply, so it is safe to take with breastfeeding. It has similar side effects to the combined estrogen and progesterone pill. The next option is the IUD, and the IUD has a hormonal and a non-hormonal option. The hormonal option, again, has progesterone only and has similar side effects to the progesterone only pills. It's very effective and comes in a regular or low dose, and it needs to be removed after 5 years. It can decrease bleeding during your period, and some women may not get a period once they have the IUD inserted. The non-hormonal option is the copper IUD. This IUD can increase bleeding and cramping during your period and is not as effective as the hormone IUD, but it doesn't have any hormones, so some women really like this option. Both IUDs can be inserted in your doctor's office. Please check out the website sexandyou.ca for more detailed information. As mentioned in previous presentations, once you're after 20 weeks, please go to triage if you have the following symptoms. All right, so a frequently asked question, will my partner be able to be there beside me during the delivery? So I'm recording this video on May 27th, 2020, and visitor policies may change by time this is viewed, so please keep that in mind. So as of May 27th, you will only be allowed one dedicated well support person during your triage visit and labor and delivery. So your support person may be given an armband once you're admitted, and they'll be asked to wear it for the duration of their stay. There may be no in and out privileges for your support person once you're admitted into the birthing suite. So please make sure that you have everything during the duration of your stay. To decrease risk of infection, your support person may not be permitted on the postpartum unit depending on the hospital. Some hospitals may ask your partner or support person to leave once you're transferred to the postpartum unit after the baby is born. So it is important to speak with your provider or check your hospital website for updates. Please click the link to fill out our anonymous survey that we will use to research the impact of our educational videos on you. Don't forget to download the handout found in the description box below, and do fill out the feedback form to tell us how we can better assist you. If there are enough questions, we will post a panel question and answer session with some of our healthcare providers. Congratulations on completing this series. Thank you for choosing us to help guide you through your special journey during COVID-19. Good luck.